along the shaft. That's due to the fusion of the labia minora, and then onto the surface of the scrotum, and that's due to fusion of the labia majora. So if you have access to a male, take a look at that. Of course, if you are male, you can just take a look at that yourself. If you have an infant, you can see it on the infants. If they're older than a year and a half or so, they're not yours. Even if they're a baby, I would ask permission. And then as a parent, obviously, depends, I always feel uncomfortable with a 3 or 4 or 5-year-old saying, I need to look at you. If you're changing diapers or something like that, you can visualize this seam line that comes from the fusion of those structures that otherwise would be separated. We talked about, I told you about that island in the Caribbean. Did I tell you about that? I guess I told the morning class. When I first started teaching, I had available a film, and it was actually on a film reel, okay, not videos. How long ago I started teaching? In 1981. That show, it was discussing some of the causes or influences of homosexuality in males, and was looking at the effects of sufficient testosterone exposure for the male fetal brain. And one of the places they went to was an unidentified island in the Caribbean, where because of its isolation, there had been inbreeding and some mutations, so that the gene, which takes the testosterone and converts it to dihydrotestosterone, known as DHT. That's what's used for these secondary sex characteristic developments. And without enough of that enzyme, there was insufficient amounts for the male babies to be born with these changes occurring. And so they looked like they had a clitoris and they had the labia minora and majora. And it wasn't until they reached puberty at around 11 or 12, a little earlier, that this fusion actually occurred. And the labia minora became the shaft of the penis, and the labia majora fused to form a scrotum at 10, 11, 12. And it wasn't uncommon. It wasn't, oh my goodness, what's happening here? This is, okay, I have a girl, maybe, maybe not. Kind of a thing. But that normally would occur, obviously, during fetal development. So let's switch back to female here. Okay, so when we talk about, it used to be called a hermaphrodite, true or false, and now there's a whole range of intersex is the more common term. It's pretty rare to have a person with a testis and an ovary, half the cells in the body XX and half the cells in the body XY. It's usually some non-expression of hormone, so that they have XY but look male, or have XX but, have XY but look female, or have XX and look male, but that's more rare. That usually is a tumor of the adrenal gland producing androgens or male hormones. But there can be a variation. We have friends whose daughter was born a week after our oldest son, and so we're home with our infant and then playing and enjoying him. We get this call, okay, we have our baby, 20 inches long, 6.5 pounds, never said whether it was a boy or girl. So I finally asked, well, is it a boy or girl? And there was this pause, and, well, we don't know. I said, well, what are you talking about? And they said, well, we think it's a girl, but one of the labia is really swollen, and so they're doing some genetic tests. And I said, just one? And they said, yes. Well, it ended up being a cyst in the labia. But they didn't find out for over a month what the genetic test results were. And of course, they're like, you don't want to call it the first child that they had. And I kept saying, I was like, if it was a genetic disorder, it would be bilateral. You wouldn't see just one side of that being affected. So she had a few plastic surgeries before she was 5 or so to go in there and repair that. But they just weren't sure until they did the genetic testing components for that. All right, so let's take a look at the gonads, which in this case, obviously, are the ovaries. And the ovaries, we're going to talk more about ligaments and the support of the ovaries and the uterus. The ovaries are kind of suspended between two. So coming down from the posterior abdominal wall, it branches off of the aorta. We have the ovarian artery and vein. And the gonads are not in a scrotal sac, they're in the pelvic cavity, so they don't go through the deep inguinal ring. And following those and attaching to this superior aspect of the ovary is a ligament, appropriately known as the suspensory ligament. And then between the uterus, let me move that over a little bit more. Between the uterus and the ovary is the ovarian ligament. The full name is the ovarian ligament proper, but typically now it's just referred to as the ovarian ligament. Remind you of a male structure that we talked about? Exactly, the gubernaculum testis. Remember I said in the male development the upper gubernaculum disappeared? That's what in the female becomes the suspensory ligament of the ovary. So over here, the upper gubernaculum, and I'm going to put it in parentheses since it actually disappears, is homologous or equivalent to the suspensory ligament. And the lower gubernaculum, what we know is the gubernaculum testis. Is the ovarian ligament. It also continues from the uterus, which is, it's not shown here, but from the uterus forward, if I can find an image, right here. So here's the ovarian ligament. From the uterus forward to the deep inguinal ring, it keeps the uterus tilted forward. This is known as the round ligament. So the gubernaculum testes forms the ovarian ligament and the round ligament. Oh. Remember in the male, the gubernaculum testis is pulling the scrotum through the inguinal canal. As it shortens, it itself is attached to the scrotal wall from the inside. So in the female, what's our homologous structure to the scrotum? The labia majora. So the round ligament passes through the deep inguinal ring, which would be right here, through the inguinal canal and into the labia majora. So we see that equivalent structure in those components. We'll look at the round ligament when we get to the uterus. And when we get to the uterus also, we'll talk about this mesoovarian, which is a very thin membranous support. You have this image of the ovary. So here's the ovarian ligament. The uterus would be over here. And with the ovarian artery and vein, we have the suspensory ligament, which isn't really illustrated there well. And this is similar to the adrenal gland. The blood vessels come into the center of the gland. And so we have the medulla, which is where the major branches become smaller and move out. The cortex is where we have all the oocytes. So tomorrow when we talk about oogenesis, or actually we're going to talk about oogenesis tomorrow, but next week when we talk about the uterine cycle and the ovarian cycle and so on, the hormonal cycle. We'll come back and talk about these structures. Right, so I'm not going to cover those sequences right now. But these are where we find all the oocytes. Oocytes are released at ovulation through the surface. And so there's a disruption on the surface of the ovaries for every oocyte that was released. Yeah?
What grabs onto the follicles?
So the follicles are all of these cells around them. So what grabs onto them, nice segue, thank you, is the uterine tube, the fimbriae. So these finger-like structures actually remind me of anemone because they swing and move around. There's actually muscular contraction for that. Okay, may I erase this from all of this list here because I want to draw the uterine tube out? Yes. Actually, I'm going to redraw this. Now, in actual position, a lot of our images of the uterus and ovaries are kind of shown in this fashion, where it looks like it's a T. Okay, I'm going to do the uterus a couple of times today. So find the uterus, and my upper extremities are the oviducts. Many of the images show it like this. In actuality, it's like this. So the uterus is bent over the bladder, and the oviducts and ovaries are posterior and lateral. Okay? So if I am the uterus again, bladder's here, I'm bent over it, close to the cervix at right angles. Oviducts go back like this, and the ovaries are back there as well. So it's not a straight horizontal component. It's easier to draw it that way, but I just wanted you to recognize an actual position. So